Do you ever feel just like giving somebody the diagnosis helps? I know, like, I've dealt with some pretty bad knee pain for a long time since I got out of the military, and I never really knew what it was. I always kind of guessed that it was probably just some arthritis and some overuse. But it wasn't until I got an MRI this year, and they were like, "Yeah, I'm just bone on bone on both knees," and they're like, "You, I'm too young for the surgery." So they
Yeah.
were like, just so I just had to make a decision. It's like I'm either going to be in pain and inactive or in pain and active. And just like making that decision and finally getting the diagnosis, all right, I know what it is, was like so relieving. And now I feel like, I mean, if I go and run, like the next day, I'm definitely in some pain. But I just felt like I couldn't play basketball with my kids, and like it
Mhm.
was like overwhelming. And then now I'm just like, damn, like I feel like I go play basketball with my kids all the time.
Yeah.
Just learning what it was and like making a decision. I don't know if the pain did go away or if like somehow I'm just like I just don't. I don't
It's
know.
not a
It was
stressor.
yeah. It was very strange
Yeah.
how drastic 10 years of pain all of a sudden, like just learning what it was. I was just like, all right, I could beat that.
Yeah, I mean, some of that can be fear avoidance. Like if you have knee pain or back pain or whatever, and you don't quite know what's going on, you're like, oh, is this activity gonna like cause me to do irreparable damage? Like, am I gonna definitely have to have surgery if I continue to fight through this pain? And then in your case, likely not. Like if you're bone on bone, like it is what it is, you're likely not gonna make things a ton worse. It might not get a ton better structurally, but you're not really gonna make anything worse. So that was, for you, that was a freeing moment. It's like, oh, it might hurt a little bit, but it's going to be okay. So sometimes it's a little bit detrimental with finding out a specific diagnosis. For example, or disc herniations. So a lot of people will hear disc herniation and immediately be freaked out, think they need to go see a spine surgeon, think they, whatever. About 50% of people have some level of lumbar herniation, whether they have symptoms or not. So you can take 1,000 people, 500 of them are going to have disc herniation. Some of them are going to have symptoms, some of them are not. And it's very likely that an equal amount of the non-herniated group are going to have similar amounts of low back pain. So for some of those people that have a disc herniation and have low back pain, finding out that diagnosis might not be the best thing for them from a biopsychosocial standpoint because they think something's so wrong with the biology that it starts to affect the psychosocial part. When in reality, most disc herniations will heal within, like I said, 8 to 12 weeks, and they'll be back to a pain-free life, whether they know that it's actually a disc herniation or not. Now, can we speed up that process with good interventions and physical therapy, the right movements, and having someone tell you it's going to be okay? Yeah, you can usually speed that up a little bit. Now, biology takes the time it necessary to heal. It's not going to be a magic solution where you get adjusted one time and your back pain's gone forever. Um, but yeah, it's so
Wouldn't that be great?
yes and no.
Yeah. Okay. You mentioned the other area that you spend a lot of time working with people is in knee pain. Um, so, um, I think when I was young, like kind of the conventional wisdom about how the body worked was pretty simple and pretty linear. You know, like you'd be like they'd diagram the bicep and they'd be like it does flexion at the elbow, and as as you get further into the study, you start to realize like our bones just kind of like float in an envelope of muscle and fascia, and like they do a lot of jobs, right? So like you go and you bench 400 pounds, or you do a 170 kilo snatch, and you've got all that weight over your head. It's not like it's attached to your trunk, like this tiny little saddle joint in your collarbone isn't holding 170 kilos, right? Like it's distributed across that whole framework of muscle and fascia and everything. So I was, pleasantly surprised, I guess. I remember like as a young man finding out that like, hey, my knee pain is because my hip's messed up, or my hip pain is because my ankle doesn't work right, or whatever. Like there's a lot of up and downstream things. Can you talk a little bit about like just, I guess like the state of care around the idea of knee pain, like looking at upstream and downstream issues, and getting stronger and that kind of stuff?
Yeah, for sure. So two of the most common non-surgical, aka not ACL tears. So most of the common injuries that we deal with in an outpatient clinic, like in a chiro or physical therapy, are going to be either quad or patellar tendonitis as far as knee pain goes. Those are by far and away the two most common issues. And both of those issues are A, load dependent. So how much are you squatting? How much are you running? How much are you jumping? How many hours of basketball practice are you running on hardwood or concrete or whatever? So most of it's load dependent, but a lot of it does come from hip mechanics. So in general, my assessment for, let's say, patellar tendonitis. I think, in my opinion, patellar tendonitis is a lot of a hip rotation issue, and flexion and external rotation are a coupled motion. Extension and hip internal rotation are also a coupled motion. But in general, like if you're missing in hip external or internal rotation, that's what's really contributing to your knee, to the patellar tendonitis pain. Generally, if it's quad tendonitis, we're dealing with a hip flexion or extension issue. And 9 times out of 10, if we can clear up those movements and then reintegrate whatever sport you want to do slowly, a lot of those things tend to go away as long as you're doing the right like mobility and stability drills as well as reincorporating your sport.